And opinions expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Good evening, everyone. Happy Thursday. Welcome to You and Your Doctor, sponsored by All County Healthcare. All County Healthcare is a Medicare certified home health agency serving Dade, Broward, and Palm Beach County. For more information, you can reach them at 954-717-7027 or info@allcountyhealthcare.com. I am your host, Dawn Graubert, and tonight we have Dr. Craig Hostig joining us. He is a cardiologist based in Plantation, Florida. Dr. Hostig is a board-certified cardiologist with Baptist Health Miami Cardiac and Vascular Institute, which is a part of Baptist Health Heart and Vascular Care. He has cared for patients throughout Broward County and South Florida, focusing on preventive cardiology, early detection, and personalized treatment plans that promote lifelong heart health. Dr. Hostig earned his medical degree from the University of Maryland School of Medicine, completed his internship, internal medicine residency, and fellowship in cardiovascular diseases through Weill Cornell Medicine affiliated institutions, including North Shore Hospital, Memorial Sloan Kettering Cancer Center in New York. He also held academic appointments with Cornell University Medical College, contributing to medical education and clinical instruction. Dedicated to compassionate patient-centered care, Dr. Hostig believes in open communication and shared decision-making, helping patients understand their cardiovascular health and feel confident in their treatment journey. You can reach Dr. Hostig at 1228 South Pine Island Road, Suite 320, Plantation, Florida, or give them a call to schedule an appointment at 786-204-4200. Welcome, Dr. Hostig.
Thank you very much. Thank you for having me.
Thank you so much for joining us.
Oh, my pleasure.
Cardiology. Let's give us some background. What even promoted you or prompted you to go into the field of cardiology?
So I've always felt into medicine as when I was growing up, and I liked sciences and physics and math, and I like the technical aspects of medicine, but I also like the personal aspects of it as well. Dealing with patients is very important, and my interactions with them are very important too. So I trained up in New York at North Shore University Hospital, and one of the first rotations was in the ICU with an outstanding cardiologist who I sort of used as my role model. So at that point in my career, I knew I was going to take that route.
Now, going forward, now you're in South Florida. You're kind of in the mecca of retired people retiring, aging, as we've all aged being here. What have you seen changes as far as cardiac care and access to healthcare?
Right. So I've been practicing for over 30 years in the area, and I've seen a lot of changes. The technology part of medicine has grown dramatically. We have a lot of very advanced testing and advanced procedures, but more important, I think we are trying to get patients in to see the doctor, to screen them, to see what their risk factors are for heart disease, and the access, hopefully is opening up with the way medicine is being practiced here in South Florida. And Baptist is doing a pretty good job with that. They are growing, and they have doctors involved that are very high level, very talented, so that patients can have access to high quality care.
What are some of the biggest health risks that you're seeing currently?
One of the biggest things is obesity. There's been sort of an epidemic of obesity, men and women, but men in particular, I think, through my experience, they usually have more of an issue with it. But and also men having obesity in a central distribution, they have belly fat, which is what we consider an inflammatory organ. The adipose tissues, those cells secrete inflammatory markers that can affect your entire body and specifically the heart.
Are you finding that a lot of the new weight loss drugs that are out there, the GLPs, are helping not only with the weight loss, but also in cardiac preventive care?
They're, they are the GLP-1s are being used extensively. You know, for the most part, it does help. There are, I think there may be a little bit of an overuse with the GLP-1s, but when it comes to patients who are significantly obese and they have risk factors like diabetes, high blood pressure, sleep apnea, the medications are definitely a significant benefit.
And for preventative care, right? We want someone to come to see you before they're having an acute problem.
Right,
When should they start coming?
So, well, interesting you say that. I had an 18-year-old in my office today who was brought in because his cholesterol was high. And his father actually had bad cardiovascular history, had a heart attack at age 40, bypass surgery at 44, a stroke at age 50, a carotid stent after that. And unfortunately, he eventually died of lung cancer. But his son came to me very early at his mother's insistence to really start to take care of himself. But 18 may be a little bit young, but in your 30s is probably a reasonable time to get a check. You want to think of your heart as you want to look at it to see what your performance is and your longevity is. And that means looking at various things in the doctor's office. A lot of these diseases that we detect are silent. They don't have symptoms. So you have to have your blood pressure checked. You should have your sugar checked, your cholesterol checked. Those are the simple things that can be done.
And what cholesterol markers are we looking at? I know there's been some new research and studies that come out. We're always worried about the LDL cholesterol, but now they're even breaking that LDL cholesterol further. What are some of the things that you're looking at, or what labs are you ordering?
Right. So a regular lipid panel with an LDL is what you start off with. And lately, over the past maybe 2 years, I've been ordering other cholesterol molecules called lipoprotein A and apolipoprotein B. Those are additional markers for increased risk for cardiovascular disease and heart attacks.
Is that go hand in conjunction with the level of cholesterol? Like, are we looking at total LDL, or are you looking at the ratio of the HDL to LDL?
The ratio doesn't matter. The HDL doesn't matter so much. The HDL only really matters if it's very, very low, like in the teens. That's a genetic disorder that predisposes you to heart disease. But otherwise, HDLs that we see in the 30s and 40s are low. We can't do too much about it. Exercise is the only way we think to raise that, but we don't focus on the HDL too much anymore. It's the total LDL. It's the total LDL amount is what really matters.
And what number is the baseline? Is it still 200 for a total? What's your LDL? Under 100?
No, the total that you're talking about, like a total cholesterol of 200. The LDL cholesterols, really in the general population, the LDL should be under 100. For those who are at significant risk for heart disease, like diabetic patients, smokers, whatever other risk factors you want to put in there, the LDL should be under 70. And if you have any sign of coronary disease, the LDL should be under 55.
Wow.
Yeah.
Yeah.
That just changed at the beginning of the year.
So you must have a lot of patients coming in going, oh my gosh, my numbers are here. It's the only way to get that number down through medication. I know we can exercise and lifestyle changes. Can only do so much, though.
No, but you're making a point there. The most important thing to do is make those lifestyle changes. Throwing medications at people, I'm not so keen on that. Yeah, I do it when I have to. I'm not really a pill pusher, but the exercise, regular exercise, 150 minutes a week, a moderate exercise, you can break that up into, 5 days a week, 30 minutes. You can even break that into 15-minute sessions. Do some. That's a moderate level of exercise. Some strength training is also good to add in there. The diet should be a Mediterranean style diet. And those are the simple things that really everybody should do. Then if we have to, we add on the medications, although there's a lot of resistance to medications like statins.
There is a lot of resistance, but a lot of people, I think, find it easier, right? It's old school. It's what's familiar. Lifestyle changes. It's harder. Yeah. It's a lifestyle change. It is exactly what it is.
But that is so important. That'll make you feel better. You'll feel better. Your numbers will be better. You'll sleep better. You'll look better. There's so much to just a simple, I know I say it's simple, but you have to go out and do it.
To get up, move, eat the right foods. They always say shop the perimeter of the grocery store versus the processed foods. Read labels.
Right. Yes. Well, unfortunately, these days people stay out of the grocery store and they do Instacart or Amazon.
That is 100% true.
There's no activity involved at all.
That is absolutely true. All right, if someone comes to see you, they need a first workup or they need a follow-up. What does your basic history and physical look like?
So the history is very important to look for risk factors like, whether or not they smoke. Their family history is very important, and getting a feel for their diet and exercise or activity routines. A physical exam is important. You may not know you have a heart murmur. I put the stethoscope on your chest and you hear a heart murmur. You may have a valvular heart disease. You may have swelling in your legs. There are a lot of physical findings that we can, we find and may need further testing. We check your blood pressure and we do an EKG. An EKG doesn't always tell you everything. You can have a completely normal EKG, but significant disease that we're not seeing with that EKG.
So with that, someone comes in, right? They present normal H&P, normal physical exam, normal EKG. Would it just say, all right, I'll see you in a year? Then it goes into the questions, family history, preventive care. Do we look at the coronary studies? Do we look at the calcium score? Are those now still, is that what we're looking at?
Yeah, so if everything is normal, you want to get blood tests. You want to check their glucose, their hemoglobin A1C, their lipid panel, maybe throw in, the lipoprotein A and ApoB that I was talking about before. So you sort of get a good picture. Now, doing a calcium score, you have to be careful with that because calcium scores only pick up calcified plaque. So if you have a calcium score of 0, that does not really rule out coronary artery disease. But if you do have an abnormal calcium score, then you have to be very aggressive with their risk factor modifications and maybe even start treatment depending on their lipid profile.
So I think the bottom line to all of this before we go to commercial break is get a checkup.
Get it checked. I mean, you can think of your heart as a machine that needs to be checked every once in a while. It has 2 pumps, it's got 4 valves, it's got plumbing, it's got an extensive electrical system. There are a lot of things that go right in making your heart, but you have to have it looked at every once in a while.
All right,
and
we're
maybe
going to take
a little oil change.
A little oil change, some new healthy lifestyle options.
Yes.
We're going to take a quick commercial break, Dr. Hostig, and then when we come back, more to come on the other side. You and your doctor, sponsored by All County Healthcare. We'll be right back.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And welcome back to You and Your Doctor, sponsored by All County Healthcare. All County Healthcare is a Medicare-certified home healthcare agency operating in Dade, Broward, and Palm Beach County. For more information, you can find them at info@allcountyhealthcare.com or 954-717-7027. Tonight, we're joined by Dr. Craig Hostig, a cardiologist located in Plantation through the Baptist Healthcare System. Let's bring Dr. Hostig back on. Well, welcome back.
Thank you.
All right. Well, I want to talk about the differences between men and women and how cardiac symptoms may present or may not present. Are they similar or are they different?
So men typically will present with more classic symptoms: chest pain, shortness of breath, the discomfort can radiate to the throat, jaw, back, shoulders, lightheaded, dizzy, sweaty, nauseous. Those are classic symptoms. But both men and women can also present with atypical symptoms. It could be difficulty exercising, just fatigue, chest pain in a different location. Those are the things that, they don't always raise red flags, but you have to think of it when you're considering cardiovascular disease in both men and women. But women will probably present more commonly with atypical symptoms.
And what are those atypical symptoms? Because I've heard women present differently. You may not have the shooting pain down your arm. You may not have the shortness of breath. So it goes undetected.
Yeah, so they sometimes can have back pain. And they may notice that their ability to do activities, whether it be exercise, housework, climbing the stairs, they may be a little more fatigued than usual. So there are a lot of different manifestations of heart disease, and you have to again take the symptoms in combination with their risk factors, their physical exam, their EKG. You can't just depend on one of those things alone.
How important is your family history, your genetic makeup?
I think it's very important. There's a tremendous number, like I just talked about this morning, this young man. With his father having a heart attack at age 40, it's very common to see a very strong family history of premature heart disease. And my patients, the children of those people have a very high risk of heart disease. So it is very important.
And hormones. I know as women, we go through menopause. Sometimes we get a racing heart. Men, their testosterone levels will decline as they get older. Are there different symptoms? And does it really affect the heart, or is it more the symptoms that we feel?
So you're talking about menopausal symptoms?
Just hormone changes for men and women. Yeah, palpitations.
Yeah, palpitations. So it's not really an effect on the heart so much. It's not a detrimental effect. It's just the changes in your body due to the hormone changes for women. For men, testosterone, it doesn't really, the low testosterone levels don't necessarily affect the heart so much. It's more the fatigue and tiredness I see with low testosterone levels, but not really cardiac symptoms.
And what are you seeing with the changes in advanced cardiac care?
It's amazing. Like I've been practicing for so long. We first started doing stents. Actually, it wasn't even stents in the late 1980s. It wasn't even stents. It was balloon angioplasty. Then it was bare metal stents for many years. Then it was drug-coated stents for many years. Now the stents are so high-tech and so good, you can put stents in multiple arteries. So that has made a big difference in the treatment of heart disease. You can have stents instead of bypass surgery. Other major things that have occurred over the past couple of years are valve replacements where you don't need to open the chest. You can do a valve replacement through an artery in the groin. You pass a catheter up to the heart. It's called a TAVR, transcatheter aortic valve replacement. You pass a catheter up from the groin into the heart with a new valve wrapped around a balloon. They pass it through the your own aortic valve, and then they blow up the balloon, and at that point, you have a new aortic valve. It takes 45 minutes to an hour to put that in without cracking open the chest.
That's incredible. And
Yeah.
all these advances in technology, I would hope people listening or watching would say, you know what, I'm not scared to go to the cardiologist, because
Exactly.
there are procedures that it's not like your grandparents used to be, or even your parents' treatment used to be.
Right. Right. There are some things that can be taken care of less invasively. They do, at Baptist, we have unbelievable surgeons who can do minimal incision, minimal invasive type procedures that are incredible. So there is a lot that can be done and these procedures have lower risk, which is what we want, and a better recovery period as well.
And the advantages of being part of the Baptist system for you as a physician and for the patients. Let's touch on that.
So Baptist has an extensive network. It's a very large organization, 12 hospitals. I think there are 30,000 employees, but it goes from the support staff to the primary care doctors to the cardiologists to the cardiology subspecialists like the electrophysiologists who take care of arrhythmias, which is another big thing for men and women. Atrial fibrillation is a big deal these days. There's a lot of atrial fibrillation, which is associated with strokes. With men and women too, there's sleep apnea that was also a predisposing condition for atrial fibrillation. So that atrial fibrillation can be taken care of with procedures. Then beyond that, the surgeons here at Baptist are world class. They take on cases that nobody else wants to touch. So they are very experienced with complex cases, including bypasses, valve replacements, and a lot of aortic disease too. That's another field that's growing rapidly, is the aorta, which is the big blood vessel that comes off the top of the heart. And essentially that pipe is used to send blood and oxygen to the rest of your body. So there are a lot of diseases of the aorta, such as aneurysms, which you may not know you have also, but we can see that maybe on an echocardiogram or some kind of CAT scan. And the surgeons here are, again, world-class aortic surgeons. It's so easy to take care of these patients because you feel you have everything behind you to help.
It must be so great for you as a practicing cardiologist to see the advances and to know that you've got the Baptist healthcare system surrounding you. So when you're doing your preventative care and the patients come to you, you know which direction you've got the support from. The patients have a great place to go. And Baptist, there's so many locations all over South Florida.
Yeah, and they continue to grow. They're building a hospital in Sunrise. Should be ready in a couple of years. So they're moving into the Broward County area, which is where I've been for a long time. So I'm happy to be able to be with Baptist and to provide those patients who I've seen for so many years with outstanding care with the Baptist system.
Okay, so before we wrap up, do we have one takeaway message for preventive health care or cardiovascular health?
Yeah. Heart disease is silent. You may not know it. You should go have everything checked, including your risk factors like high blood pressure, diabetes, high cholesterol, sleep apnea, obesity, and then you need to take it from there. You cannot take those risk factors lightly. It should be looked into further at the direction of your cardiologist.
And lifestyle changes are important, and you can make them one step at a time.
Exactly, exactly. I mean, like I said, you can do your 150 minutes sounds like a lot per week, but you can do, 3 10-minute walks during the day. That's your 30 minutes 5 times a week. It doesn't sound like that much if you break it up that way, but it's got to be moderate exercise. It's not just a casual walk, talking on your cell phone.
Little by little. Dr. Hostig, thank you so much for
Yes.
joining us. Again, you can reach him at 1228 South Pine Island Road, Suite 320, Implantation 33324, or to make an appointment, 786-204-4200. Thank you so much for your time. It was a pleasure to meet you.
Same here. My pleasure. Thank you very much for having me.
And for more information for All County Healthcare, you can reach out to them at 954-717-7027 or info@allcountyhealthcare.com. Have a great evening, everyone. Until next week, I'll see you then. Bye-bye.